The trial has subset analyses, and I think there are a number of them that are of interest. For one, patients that got the durvalumab early, so the end of chemo RT, and then within 2 weeks they start durvalumab, they seem to do better. And that could simply be those patients had smaller tumors, less complications, they simply got there earlier. It could also mean that giving the drug early is important. And you could make a theory around either one. That needs to be tested. The second one was, what about EGFR or otherwise mutated patients that were included? We don't really know the role of targeted therapies in stage 3 disease. Here, the group of patients with identified mutations is too small, so we don't have that analysis. It doesn't seem to me to be a worrisome outcome if you just look at raw numbers, but technically we don't know. And a third question, is there one, has to do maybe with the timing. That's, I think, a big unanswered question. It relates to the first one. So if you give it afterwards and it's beneficial, should you also give it during chemo-RT? Or maybe even before neoadjuvantly. And so those are sequencing questions that we look at, and we don't know the answer yet.